Well done, guys, and we are powering through tonight. Hold on, stay with me. You're getting there. You're doing very, very well. Let's put another 2 minutes on the clock for case number 3. Time starts now. Lakshmi is a 55-year-old woman presenting to the general practice for a routine checkup. She has no specific complaints, but mentions she has a family history of bowel cancer. Her mother was diagnosed with bowel cancer at the age of 50. She's never undergone any screening tests for bowel cancer. She denies any significant symptoms such as rectal bleeding or changes in bowel habits. She does not smoke and drinks 2 glasses of red wine most nights. She's had no other medical history and takes no regular medications. On examination, there are no abnormal findings. Her vital signs include a temperature of 36.8, blood pressure of 130/80, heart rate of 75 and a respiratory rate of 16 with a BMI of 26.2. What is the appropriate screening recommendations for Lakshmi based on her family, history and age? Provide one recommendation. All right, time is up and let's get to some answers. If she was under the age of 50, we'd be talking about the FOBTs every 2 years until the age of 50, from 40 to 50. After 50 to 74, 75, you'd be going for colonoscopy every 5 years. And of course, this would be commencing now. She'd be getting a referral now for colonoscopy and then every 5 years. That would get you the full 2 marks. If you don't specify an age range, then you would, but specified the colonoscopy every 5 years, you would still get 1 mark there. So excellent. Well done there, Demir. Absolutely nailed it. Just slightly off with the... Oh, no, there we go. We have the correction in place. And yes, 5 yearly colonoscopies. Very well done. Now, I've thrown up here, and feel free to take a screenshot or I can make this downloadable. This is a summary of the cancer screening recommendations from RACGP. And one of the recommendations through here is an asymptomatic person with 1 first-degree relative diagnosed under the age of 55 puts her into the moderately increased risk category, again with our recommendations in through here. All right. Of course, we have more questions ready to go. So let's put 2 minutes on the clock and your time starts now. She has a positive result on screening and subsequently returns showing a histology report stating there were 7 adenomatous polyps without evidence of invasive malignancy. She asked what she should do next to help prevent the progression to colorectal cancer. What management actions would you take to decrease her colorectal cancer risk? Give 5 specific management actions. Doses are not required. time is up and let's get to the answers. So thankfully, there's actually lots we can do to try and decrease risk of colorectal cancer. Now, number one thing to try and decrease her risk is to repeat the colonoscopy in 12 months. And for that, you would be getting the 2 marks. And the reason for that is the 7 polyps that are in there. That's a lot of polyps. Of course, if it was over 10, you'd be repeating that within 12 months. Under 5, you would be repeating it at the 5-year mark. But in that 5 to 10 range, she's getting another colonoscopy in 12 months, and I would apologise profusely for the bowel prep. Now, next up would be, of course, commencing low-dose aspirin daily for at least 2.5 years until the age of 70. Again, that would give you 2 marks, given it's one of the few interventions we have to directly decrease the risk and has potentially other health benefits as well, which are undergoing further study. If you didn't specify the time frame, even though it hasn't specified dosing, I'd still say the age ranges would be outside of technical dosing, and so you would probably get still a mark, but less marks for that. Provide lifestyle risk factor counselling on the benefits of regular physical activity or exercise would get you a mark. Maintaining healthy weight with a BMI of under 27, and there you'll note we specify maintaining healthy BMI, and so even though she's technically within that criteria at the moment, we would be encouraging the health benefits of maintaining that. Recommending alcohol intake in the low-risk range of no more than 1 drink per day, given she's female. If she was male, we would be looking at 2 drinks per day, which I think is a bit weird. I think it would depend on the size of the person and background. But anyway, I'm getting distracted. Recommend the consumption of vegetables or sources of dairy fibre. I wouldn't be putting both. I'd just be specifying one, but they would be grouped together. So I'll put that there just to simplify it for tonight, as they may be protective. And, of course, recommending only moderate amounts of red meat. Again, grouping. Minimise the consumption of charred and processed meats would also get your mark there. So, very good. I can see some of those answers trickling through. Fantastic. Just to be really nitpicky in terms of... Where are we? The alcohol, I would be saying minimise alcohol intake any further. I would give a specific recommendation, and so actually specifying number of glasses would probably be more likely to secure those marks, but otherwise, fantastic. Again, on that same note, regular follow-up with a specialist for a follow-up. I would be trying to specify timeframes, and so again, saying the 12-month mark for repeat colonoscopy, and I'm always hesitant to say put specialist. I would specify which specialist you're talking about, because it could be general surgeon, could be colorectal surgeon, could be even, depending on where you are, gastroenterologists might be doing the scopes there. So I'd give an actual name, and instead of just saying for follow-up, for repeat colonoscopy. Otherwise, fantastic. Okay, and of course... aspirin daily weight loss aiming to BMI under 25. I will double check the reference I used, but I think they had 27 as their number. Having said that, under 25 would still be a fantastic thing, and I don't know if you would lose any marks for having that. Now the exercise is perfect. Eliminate consumption of processed meat, increase dietary fibre consumption. Nailing it, guys. You are going to be fine and fit for the weekend. Very well done. But of course, get ready. There's more. Time starts now. Given all your recommendations, she is keen to have a care plan made to document and plan these interventions. She's heard from her neighbour with asthma that there are chronic disease or GP management plans and wants to know more information. What are the requirements of a comprehensive chronic disease management plan as per MBS item 721? List 4 required components of the written plan. right, time is up. And let's get to the answers. Now, this is one of those questions that they can throw at you, and it's a bit of a pain, and it's easy to freak out on the day, but there's good news. These are things you do every day. And so if you ever get stuck in one of these types of questions, just ask yourself, oh, geez, what is on that form? Because that's all you're going to need to put down. You need to document the patient's healthcare needs or problems or relevant conditions, the management goals to which the patient agrees, the actions to be taken, the treatments or services they're going to need, the arrangements for providing these treatments or services, and the arrangement to review that plan by a specified date. And so this is one of those ones that I think we can overthink and spin ourselves out, but just go back to, well, what do I put on the form? And it may be a DVA question, it may be a care plan question, it may be an asthma management plan question. Just picture that form in your head, draw it out if that helps you as well, and think what is there. Now, in terms of eligibility, and you've popped that there as well, you should have chronic condition lasting for at least 6 months. Yes, that is actually definitely true, and I think if you put that down, you would get a mark there. Patient could consent to the preparation of chronic management plan. Yes. I think, though, you would probably lose a bit of specificity in there in terms of she's already come in and saying that she's wanting the plan there. It is, though, if we're being specific, it is a requirement as per the item number. And so, yeah, I think you would get that mark. And that she should be requiring complex care. Technically isn't part of it. There is the requirement to have multiple care providers, but I think you'd potentially miss out on that one. But I can see what you're getting to there, and I think, and yep, you've just popped it into the chat as well. Running out of ideas. Yep. I really like that creativity though. Now, in terms of a new plan can be prepared every 12 months, not actually part of the item description, just kind of a lapsing of it. I don't think you would get a mark for there. Again, I'd probably say go back to what you're writing on the actual forms themselves. But look, a good punt. I liked it. And look, sometimes that's what you got to do. And admittedly, I think you'd get a few marks from there that even though they weren't on this list here, technically were part of the item number. So well done.